Joining us now, Leena Menghaney. She's with MSF Access, Médecins Sans Frontières. Thank you very much for being with us as we are your partners in this mission. How close are we to seeing a vaccine in this fight against COVID-19?
Yeah, I think this is on everyone's top of their mind that, the vaccine is going to be coming along and, we're going to get ourselves out of this economic and social isolation with the vaccine. But I would like to also emphasize that as MSF, we give equal importance to therapeutics, the medicines that are needed today, as much as to the vaccine. So I think we have to learn to live with COVID firstly. You have over 100 candidates. You have the best scientific minds on it. But what is really disturbing is that we still don't have a framework to decide about whether the poorest and the most vulnerable in the world will be ensured access to the vaccine. So if there's a breakthrough, India will be making those vaccines, because without India, you cannot move along. But what is not in place is a very good framework that the poorest and the most vulnerable should be getting the vaccine.
Leena ji, what is being done to make sure that everyone is able to access a vaccine when it is created?
Well, there are a number of initiatives. The WHO is working on an allocation framework. You've got the Vaccine Alliance working on pledging money and raising money for the vaccines. You've got CEPI, which is the Coalition for Pandemic Emergencies. You've got lots of good minds and a lot of good institutions working together to do something about creating access to vaccines. But actually what has really happened is, and this happened in 2009 as well, is that the wealthiest countries are already drawing deals with big pharmaceutical companies to ensure access to people in their countries. And that in some ways undermines the solidarity that we need at this point, is that whether you're rich or poor, wealthy or not, you should all be ensured access to vaccines. So I think in the coming year, I think the Vaccine Alliance, CEPI, WHO will all be tested in their ability to ensure access to the most vulnerable.
Okay, Leena Menghaney, thank you very much indeed for joining us.